So I have a bilingual bonus. I am not fluent in Spanish to the point like a native person, but most of the time I get through my visits and everyone understands each other. And I think that I have enough of a vocabulary to be sensitive in talking about LGBTQ people. So for me personally, uh, just having the education, having the life experience of speaking Spanish, I'm able to do that. There are some times, occasionally, when I will need an interpreter, even with Spanish, when there's a word that's said that I don't understand, then I get an interpreter because I need to make sure that I understand every bit. And with other languages, it is more challenging. I haven't really had to have these conversations too often in other languages. Um, Only rarely we're talking about sexual orientation and gender identity. We also have interpreters to make sure that we're getting our message clearly heard and that the patient's message is getting clearly heard and that we understand each other. I think it is challenging because then there's another person listening. So just explaining that these services are very confidential and that they're not going to be sharing any of the information that they hear, that the interpreters won't, I think is very important so that the patients feel that their needs are being met. I think with the children that I have, most of them speak English, but many of the parents speak Spanish. And so I think sometimes separating the child from the parent too. I mean, we do that anyways in well child visits, especially when a child's a teenager. But sometimes if they're even younger and they seem like they're struggling, sometimes it's good to just separate them out from the parent. If the child feels that they can better explain themselves in English, sometimes that's also very helpful, or if they want, again, to explain things confidentially.